You're good.
I'm going to do the Charrette protocol for the shoulder. Have the patient hold, push down. That's a grade 4 or less. Scoot over just a little bit. That indicates an anterior humeral head. Scoot down just a little bit. There you go. And I'm going to do an A to P thrust wrist extension technique, and that's 10 to 15 pounds with my indifferent hand, 10 pounds with my speed hand. Now we're going to do the supine alternative adjustment. Scoot over this way just a little bit. Good, elbow comes up, or hand comes up to 45. We're tractioning, again, A to P thrust, down in that humeral head. Sit up for me, face that way. Now we're going to do the seated alternative. Support the scapula, feeling for restriction, and again we're going to do an A to P thrust for that anterior humeral head. Next we're going to do for an anterior medial clavicle. So we're going to reach across, thenar on the clavicle, come up, and this is a medial to lateral, turn your head away, this is a medial to lateral mobilization of that clavicle. 3 times. Okay. Now we're going to test the AC joint. So patient raise the arm up, beyond the clavicle, and we're testing for springy infill. If it is springy, it shouldn't be springy, so if it is springy, we're going to do an S to I thrust onto that. For the trigger points, we're going to start with subclavius and mid-scapular. Work those. Then we're going to go to teres minor, teres major. Next we're going to do levator scap. Next we're going to do lateral deltoid. Next we're going to do subscapularis, which is underneath. Pull the lat out of the way, and then last we're going to do the medial humeral head. We're going to do the scapulothoracic articulation. So we're supporting front and back, and we're going to do I to S, A to P mobilization of that. We're going to check for inferior glide of the humeral head. That should feel springy. That's going to be an S to I test. And then lastly, we're going to do levator scap tendon. So have the patient raise their shoulder. Good. Relax, support the shoulder, and we're working medial to superior border of scapula on that levator muscle tendon.